nice to see you.
Yeah, nice to see you.
Thanks for agreeing to spend some time with me today.
Oh, sure. It's my pleasure.
So, you're a recent graduate of the McDougall Program,
Yes.
but already there's changes that are occurring in your life, I'm sure.
Yes. Yeah. Big changes, and that's good. So I'm sticking with the program, and I've noticed, I've had a history of AFib, and my AFib, I'm hesitant to say this but it's gone. And but there's always, the thought it could come back, but it was really um, disturbing for me. It's been like maybe 5 years that I've had the problem, and I feel so much better. I just am delighted. I don't know. Um, like I said, it could come back, but I don't know if you know too much about AFib, but I didn't have it all the time. I only had episodes of it, brief episodes, but there was one time where I had to go into the hospital quite a few times, but once they had to cardiovert me.
Oh, wow.
Oh, I know. So it was terrible. And they treated me with medications, and turns out maybe my thyroid was part of the problem. And I was on too much thyroid medication, and nobody seemed to know that. And when they found out, they measured my thyroid level, and I was on so much medication, it was off the chart. So they lowered that, but he also increased. Before they realized that, though, I had to go in for my own, I had to order my own thyroid test because I suspected something. But anyhow, so before they found out it was my thyroid, they increased my diltiazem, and I swear I almost died. So I'm here today to tell the
Good.
story, but I'm still on metoprolol, a low dose, Crestor, which is a statin. They started a very low dose of thyroid medication, and I stopped taking the metoprolol, but I'm still on trying to think what's flecainide. And so, all those drugs have side effects, and
Sure.
so it's my hope to eventually, like I talked with Dr. Lim, be able to get off or quit taking most of them eventually if I stick with the program and lose just a little bit more weight. I'm
That's
feeling
the
good
goal.
now. Yeah, so I'm feeling amazing. I'm just have energy and no heart palpitations, and I'm just hope it lasts. Let's say that. But yeah.
So how have things changed for you since you've gone through the course?
Um, in which way? That's the way it's changed for me in my health. In other areas of my life too.
Well, I mean, you're feeling better. You've got more energy.
Oh yeah. I can do more work. I have a high tunnel. I grow vegetables, which lucky me, are lots of vegetables. So I'm able to get more done. I sleep better. I sleep way better. I can actually sleep through the night now, which is a big change for me.
That's great.
Yeah, I think so.
So what would you say to someone that's on the fence about signing up for a course?
Oh, just do it. Just do it. Yeah. I kind of debated myself for a while, and because money's always a factor, right? And I've read a lot of different books on nutrition, and I just made up my mind. I'm just going to do it. And there's no going back. This is it for me. I'm convinced that this is like Jeff says, how did he put it? Most likely the healthiest diet on the planet. So yeah, I'm really happy.
That's great. Thanks, Jackie.
Yeah.
Let's see. How do you see yourself staying on track? Are you keeping things simple?
I'm keeping things simple. I'm actually going to try some of Jeff's suggestions with the batch cooking and the frozen vegetables, because I'm busy like we all are, and I think that might help.
That makes things easy.
Yeah, the
Wonderful.
simpler the better. So I keep reviewing my notes, and that's been popping out at me, that keep it simple, and that seems to be the way to go.
Good. Well, we're here for you. You've got your support specialists and our twice monthly meetups and the Wednesday meetups. So a lot of opportunity to stay in touch. So glad you're feeling good and excited about the future.
Yeah, it's just amazing. Have you heard of that before, with someone's AFib going away?
I have. I mean, it's not typical, but I'm never surprised by what the body does. When you stop attacking it with bad food and just start treating it right, it's amazing what heals.
Yeah.
So
Yeah.
I wouldn't say anything's impossible of being fixed or healed, or I've seen some amazing things. So I would just, hold on to that and appreciate that, and hopefully it'll stay.
Yeah, I hope so too.
Well, I appreciate your time, Jackie. Please reach out if you need anything.
Thanks, Heather. And it was really nice meeting you. And thank you for taking time to listen to my story.
Absolutely.